Kevin, you'll unmute it at the right time. Okay.
Bonjour tout le monde. Hello. Je suis heureux d'être.
I'm happy to be here, accompanied by Minister Leblanc, Minister Joly, Dr. Tam, and Dr. New.
I'd like to address the recent news coming from the United States, where the President and First Lady have tested positive for COVID-19. Sophie and I both wish President Trump and First Lady Melania Trump a safe and speedy recovery. Plus tôt cette année, les Canadiens ont travaillé fort.
Earlier this year, Canadians worked hard to stop the spread of COVID-19. Our battle is not over, and we must continue to do our part to save lives. The number of cases is on the rise across the country, and it's of the utmost importance to follow all public health guidelines, to wear a mask, to maintain a 2-meter distance from others, to wash our hands, and to download the free app COVID Alert. With respect to the app, we need to continue to encourage all of the provinces to use this very helpful tool. Prince Edward Island and Nova Scotia have now joined on and opted in alongside the other 5 provinces. The Quebec government will be making an announcement on this subject shortly. As a member for Quebec, I can't insist enough that it's important to use all tools available to us in order to protect Canadians. I will reassure you that the app fully protects your privacy. It doesn't collect data on your location. And the Privacy Commissioner supports the use of the app. Initially registered, don't wait, because the app starts working immediately to help protect you as soon as you've downloaded it. I would encourage all Canadians to download the app COVID Alert, free from the App Store, from Google Play, in order to contribute to keeping you safe and others as well.
Has been a Team Canada effort, and last month, First Minister's meeting with the premiers since the start of this pandemic. Minister Leblanc will talk more about how all orders of government are continuing to work together to keep Canadians safe. Since the beginning of the pandemic, our government has been focusing on supporting Canadian workers and the small businesses that create good middle-class jobs. We created the Canada Emergency Wage Subsidy, which kept employees on the payroll. And we also introduced the Canada Emergency Business Account that helps employers pay for things like hand sanitizers and face shields. To support even more businesses, we invested almost $1 billion to create the Regional Relief and Recovery Fund. This funding flowed through the regional development agencies, with a portion also going to the Community Futures Network to help businesses in rural and remote areas. These organizations know the specific needs of their regions and the businesses they serve. And we've heard from small businesses about how important that funding was to keep the lights on. We need to continue to support workers and small businesses as we move through this second wave. So on that front, I have some important news to share. Today, I can announce that our government is investing another $600 million for the Regional Relief and Recovery Fund. This work and 5 regional development agencies, the Atlantic Canada Opportunities Agency, Canada Economic Development for Quebec Regions, FedDev Ontario, FedNor, and Western Economic Diversification Canada. Minister Joly will have more to say, but here's the bottom line. We will be here for Canadians, whatever it takes, for as long as it takes. Aujourd'hui, j'annonce que notre gouvernement va investir.
The Prime Minister is still speaking. Today, I'm announcing that the government will award another $600 million for the Regional Relief and Recovery Fund. This will serve to help the Community Futures Network and the 5 development agencies in the regions: ACOA, Economic Development Canada for the regions of Quebec, FedDev, FedNor, and Western Economic Diversification. Minister Joly will have some additional details on this topic in a few moments, but here's the bottom line. We are doing our utmost to support Canadians during this crisis, as long as it lasts.
In the last 6 months, most Canadians have been able to stay at home if they need to, because they have a safe place to live. But that isn't the reality for everyone. Women and children who are the victims of violence often don't feel like they have anywhere else to go. And that's unacceptable. Earlier this year, we invested $50 million to support over 1,000 women's organizations and shelters across the country. And this funding helped them do things like hire more staff to manage work and improve cleaning and safety plans. No one should have to choose between facing violence at home or dealing with a pandemic in the streets. We know that women's safety must be the foundation on which all progress is built, and today we're taking another step to address gender-based violence. The Government of Canada is investing an additional $50 million to support organizations that provide services for women and children who face violence. The funding will include $10 million for women's shelters and sexual assault centers across the country, and another $10 million for gender-based violence services that support Indigenous women and children living off reserve. The remaining $30 million will go to women's organizations that combat gender-based violence, including those that deliver vital services like counseling support and crisis intervention. I'd like, as always, to thank Minister Monsef for her tremendous work on this important issue. Our government will continue to be there for those who face gender-based violence, and we will continue to work with the organizations that support them. Le gouvernement du Canada versera une contribution.
The Prime Minister. The Government of Canada will invest another $50 million to organizations providing assistance to women and children facing violence. $10 million will go to shelters dealing with sexual violence. Another $10 million will go to fight gender-based violence, providing support to Indigenous women and children living off reserve. The remaining $30 million will go to organizations that fight gender-based violence, including organizations providing vital services, including counseling and crisis intervention. I want to thank Minister Monsef for the important work that she has done on this file. Our government will continue to be there for violence of gender-based violence. We will continue to work with the organizations that support them.
Recognizing that October is the start of Women's History Month. Our country would not be what it is without the tireless and selfless contributions of women throughout our history. Every day, women across the country dedicate their lives to making Canada a better place for everyone. As we celebrate these women, I encourage us all to remember our own role in being active allies. And let's work together to advance gender equality through our everyday actions. Merci tout le monde. Je cède maintenant la parole à la ministre Joly.
Thank you very much. I'll give the floor now to Minister Joly.
I'd like to thank Dr. Tam and Dr. New for being here, toujours au rendez-vous pour les Canadiens, as well as the Prime Minister as we announce this important support for Canadians. C'est indéniable qu'au courant des derniers jours, on a franchi une...
Minister Joly, clearly, we've moved on to the second wave of the COVID pandemic. It is happening now, and it's affecting millions of people who need to modify their habits. And in Quebec, it means a return to lockdown. As Minister responsible for economic development, I'm clearly thinking about our entrepreneurs and workers. I know, and you've told me, you've all worked hard to get through the first wave. You worked hard to continue to pay your employees. You worked hard to keep your shelves stocked and to continue to offer services. That's why, for you, the Prime Minister and I are announcing an additional investment of $600 million through the economic development agencies for the regions.
We've rolled out major initiatives to help Canadian workers and businesses stay afloat. These programs have made a major difference. But every time you extend the social safety net, you really need to make it tighter to make sure that no one falls through the cracks. And that's why we created the Regional Relief and Recovery Fund, the RRF, through our regional development agencies, which, for example, are OCOA in Atlantic Canada, DEC in Quebec, FedNor and FedDev in Ontario, and Western Economic Diversification in the West. Over the past months, it has helped 12,000 businesses, and it has protected nearly 95,000 jobs all across the country. I'll give you a couple of examples. Akuva Technologies in BC, which develops technology to clean drinking water. The Member 2 Band Council, which creates opportunities for its members on Cape Breton Island. Vaxic Inc., a woman-owned startup that's revolutionizing professional services in Manitoba. We also help many tourism businesses from hotels, restaurants, and travel agencies as they're going through really difficult times. But I'll give you one specific story. One person I'm thinking of is Roxanne, who runs the Mount Logan Lodge in the Yukon. Roxanne recently told me what a difference the RRF has made for her. While her lodge has almost no guests due to COVID-19, which is pretty much a drop of 98% in revenues, and her costs haven't stopped. With tears in her eyes, Roxanne said that without the help of Canor, her business would have been forced to close. And we're here for people like Roxanne. Having heard the concerns of workers and of businesses, we're devoting an additional $600 million to our regional development agencies to help them. Aujourd'hui, avec un nouveau souffle au programme, on a...
Minister Joly speaking. Today, we are going to continue focusing on the next stages, and I'm happy that we have more resources on the ground. Thanks to our agencies, we can help companies make ends meet. The agencies are in the regions. They work directly with entrepreneurs in our regions. In a context where we're already seeing a lockdown in some regions, and we know that some sectors are more affected than the others, and I'm thinking about tourism, but also about hotels and restaurants, our presence on the ground will provide a great deal of assistance.
Major impact on small businesses and the millions of Canadians whose livelihoods depend on them. Despite being hit hard by COVID-19, they've kept people on their payroll, kept their shelves full, and kept serving their communities. And today, we're keeping our promise to them. We're here for them, and that's why today, it's all about protecting local jobs and ensuring that the support they need, that they have access to the support they need, not just to survive, but to thrive. On sait que ce n'est pas fini. Il faut continuer.
Minister Joly, we know that it's not over. We need to continue supporting you. Your families, your communities need it. And we want to make sure that we're there for you. We've been there since the beginning. We're here now, and we will continue to be there for you in the future, because we will make it through this all together. I'm happy now to give the floor to my colleague, Minister LeBlanc, who is in New Brunswick. Minister LeBlanc speaking. Thank you, and I'm speaking to you from the ACOA offices in Moncton.
Canadians in all 4 Atlantic provinces will be able to use the COVID Alert app as an extra measure to keep themselves and their communities safe. Individuals using the app would be notified if someone they came in close contact with chooses to report their COVID-19 diagnosis, which means instead of going out and further spreading the virus, they would know to get tested and to self-isolate. With the app soon to be fully operational in Prince Edward Island and in Nova Scotia, it's now ready for use in 7 provinces. I want to thank the provinces for their hard work in getting this done for the safety of their residents. We continue to work with other governments to roll out the app across the country. As an Atlantic Member of Parliament, I invite everyone in Nova Scotia, in Prince Edward Island, and indeed across the country to join the already 3 million Canadians who have downloaded the app, and I ask you to do so today. Yesterday, I also joined the Prime Minister at the 19th First Ministers meeting held since the beginning of the pandemic. This was also the first meeting since the beginning of the second wave. We all agreed in our continued commitment to the Team Canada approach to minimize the impacts of an increasing caseload of COVID-19 and to support, obviously, the economic recovery. Depuis le début de la pandémie, notre gouvernement
Since the start of the pandemic, our government has been working with the provinces and the territories to better support all Canadians. I'm happy today to say that we are in a position to use COVID Alert, the application in Nova Scotia and Prince Edward Island. It's already up and running in Newfoundland and Labrador and New Brunswick. So if you live in one of the 4 Atlantic provinces, you now have an additional tool to keep your communities safe and healthy. For the residents in Nova Scotia and Prince Edward Island, I invite you to join the 3 million Canadians who have already downloaded the app. The more we are to use the app, the more effective the app will be. Yesterday, I had the privilege of participating with the Prime Minister in the first Minister's meeting since the start of the second wave. We talked about contact tracing, testing, and candidate vaccines. We will continue to work with all governments to minimize the impact and the spread of COVID-19, and clearly to support economic recovery. With that, I thank you, and I will now give the floor to Dr. Tam and to Dr. New.
Good afternoon, good day, bonjour à toutes et à tous. There have been 160,535 cases of COVID-19 in Canada, including 9,319 deaths. Over the past week, labs across Canada have tested an average of over 71,000 people daily, with 1.8% testing positive. Case counts continue to rise, with an average of 1,634 new cases being reported daily during the most recent 7 days. Accelerated epidemic growth, particularly in high-incidence areas of Quebec and Ontario, is driving the ongoing increase. New cases reported from these provinces account for almost 80% of the national case count. More recently, we are seeing an increase in severe outcomes of COVID-19, which we're keeping a really close eye on. Over the past week, there have been an average of over 500 COVID-19 cases in hospital on any given day and 10 deaths reported daily. As more and more local areas are experiencing high infection rates, local public health, healthcare, and laboratory services are at risk of being overwhelmed. Hospitals that are trying to catch up with a backlog of important elective procedures may be faced with the difficult decision of postponing these further. So here comes the part where we talk about what we need to do more of and better. The thing is that the momentum of the COVID-19 epidemic curve is the opposite of a roller coaster. The way up is fast and easy, but the way down is long and slow. And downward momentum can be stopped or even reversed with any wrong step we take. At this point, the tireless efforts of our frontline and essential service workers is COVID fatigue of the highest order, and yet they go on, because providing care and services to Canadians is what they do. They have our backs. Now it's time for us to match, or better still, double down on our tireless efforts to bend and plank this latest curve. Although our goal has remained steady, to minimize severe illness and deaths, this kick at the curve is a bit different. Now that we have open schools and businesses and want to keep these important spaces open, we all need to do our best to keep the infection rate to manageable levels. This time, we've got to bend it like Canadians. We'll need to give it the old double-double by layering personal risk assessment and prevention practices and reconfiguring and downsizing our in-person contact bubbles within the realities of our personal and family circumstances. It's time to step up to the plate and get in the game. Speaking of getting in the game, I'm excited to say that the Public Health Agency of Canada and the Entertainment Software Association of Canada are joining forces to reach millions of young Canadian gamers with messaging about public health measures they can take to help minimize the spread of COVID-19. So let's get this done together. Thank you.
Bonjour à toutes et à tous. Il y a eu
Dr. New. Good afternoon, everyone. There have been 160,535 cases of COVID-19 in Canada, including 9,319 deaths. Over the past week, labs across Canada have tested an average of over 71,000 people with a daily rate of 1.8% testing positive. Case counts continue to rise with an average of 1,634 new cases being reported daily. Accelerated epidemic growth, particularly in high-incidence areas of Quebec and Ontario, is driving this ongoing increase. New cases reported from these provinces account for almost 80% of the national case count. More recently, we're seeing an increase in severe outcomes of COVID-19. Over the past week, there have been an average of over 500 COVID-19 cases in hospital on any given day, and 10 deaths reported daily. As more and more local areas are experiencing high infection rates, local public health, healthcare, and laboratory services are at risk of being overwhelmed. Hospitals that are trying to catch up with a backlog of important elective procedures may be faced with the difficult decision of postponing these further. So here comes the part where we talk about what we need to do more of and better. The thing is that the momentum of the COVID-19 epidemic curve is the opposite of a roller coaster ride. The way up is fast and easy, but the way down is long and slow. And the downward momentum can be stopped or even reversed with any wrong step we take. At this point, the tireless efforts of our frontline and essential workers is COVID fatigue of the highest order. And yet, they go on because providing care and services to Canadians is what they do. They have our backs. Now it's time for us to match, or even better still, double down on our tireless efforts to bend and plank this latest curve. Although our goal has remained steady, to minimize severe illness and deaths, this kick at the curve is a bit different. Now that we have opened schools and businesses and we want to keep these important spaces open, we all need to do our best to keep manageable levels. This time, we've got to bend it like Canadians. We'll need to give it the old double-double by layering of personal risk assessment and prevention practices and reconfiguring and downsizing our in-person contact bubbles within the realities of our personal and family circumstances. It's time to step up to the plate and get in the game. And to add some additional information, health officials and the Gaming Entertainment Association are reaching out to gamers by sending information about measures that they can adopt to help minimize the spread of COVID-19. Like young gamers say, it's time to get in the game. Thank you.
Thank you, Dr. New. We'll start on the phones with questions. I would also like to add, to allow more specific direct questions for the doctors, the Prime Minister will excuse himself after about 20 minutes of questions, and then they'll be available after that. Right now, over to you, operator. Phone line, please.
Thank you. Merci. Première question, Hélène Buzetti. À vous.
Thank you. My question is for Mr. Trudeau. I'd like to go back to the apologize October crisis. So you talked about thinking about Pierre Laporte's family, and no one talked about the bombs, but we're talking about people who were arrested, some 30,000 people who were subjected to searches because they were independentists or because they had communist literature in their backpacks. Those people were arrested for no valid reason. Do they warrant apologies as well? Reply from the Prime Minister. The events of October 1970 were very difficult for many people. And I think that we need to continue to think about that. The federal government, the provincial government of Quebec, the municipal government in Montreal as well, all had a role to play during the events surrounding the October crisis. As I said, we all need to remember Pierre Laporte's family. These are very difficult memories for them. The events remain difficult for them. Question. Since the start of your mandate, you've apologized for many historic issues that have arisen. Why wouldn't you do it here? Some people think it's because you don't want to refer back to your father's legacy. The Prime Minister. Answer. Well, as I've said in the past, no one is perfect, nor was my father. There are many things from the past that we need to think about, things that we've done. With respect to the October crisis, it was a very difficult situation. I think that first and foremost, we need to think about Pierre Laporte's family. He was assassinated by people who resorted to violence, who wanted to create societal change. We live in a country where democratic processes are violence-free. We focus on dialogue, respect, and we need to be proud of that. Next question.
Thank you. Merci. Next question, Ryan Timothy, The National Post. Line open.
Yeah, good morning, sir. You're announcing this fund to the regional development agencies today, but I think a lot of businesses across the country are wondering about rent relief. You said that there would be a replacement for the program. Rent was due for many businesses yesterday. Do you have any update on that?
The announcement we're making today is going to make a significant difference in small businesses right across the country. We've seen that with the large programs we put forward in the spring, whether it was CERB, whether it was the Canada Emergency Business Account, whether it was the wage subsidy, whether it was other measures like the rent relief support we worked on with the provinces, there were still many small business, particularly in rural or remote areas, that were falling through the cracks of those particular programs. That's why our regional development agencies were so important in stepping up and supporting detailed supports personalized for the businesses most in trouble. Now that we're facing the second wave, it is really important to make sure that those regional development agencies can continue to be there for those very small businesses who will need support through the second wave. As the Minister of Finance said yesterday, we are very aware of the concerns businesses of many different sizes are looking at for rent relief. Commercial rent is a provincial jurisdiction, but the federal government is going to be stepping up. We will have more to say on support for fixed costs in the coming days.
Follow-up, Ryan?
Yeah, both Ontario and Quebec, as well as some other provinces, are seeing record high numbers of cases today. They're seeing in Ontario, we have a huge testing backlog. I'm wondering if you're still comfortable with how the provinces are handling this crisis, if you think they need to do more to keep numbers down and to keep up with testing capacity.
Well, first of all, you highlight that they're seeing a large number of cases today. Those aren't today's numbers. Those are numbers from 2 weeks ago. The behaviors that people have on one day don't really become manifest until a week or 2 weeks later because of the way COVID-19 works. So if we want to actually bend the curve, if we want to get this under control, we need to all do our part today so that we can be in a better place 2 weeks from now. And that's the really important thing. Governments are continuing to act. We're working closely with the provinces on increasing testing, on supporting businesses so that we can handle more closures or more suspensions of economic activities, because we need to do that. But Canadians need to do their, people realize that if they manage to stop the spread of COVID-19, if they are able to take on behaviors that prevent them from catching COVID-19 or prevent them from spreading COVID-19 if they may have it, that's how we get this under control. People know what that means. That means wash your hands. It means keep your distance from each other. Don't go out unless you have to. Wear a mask. And download the COVID Alert app everywhere across the country. Even those provinces that haven't signed on yet, the app starts to work right away as soon as you download it. And the more people do that, the more we will be able to arrest the spread of COVID-19. Je pense que c'est important de souligner que les chiffres.
The Prime Minister speaking. I think it's important to point out that the figures and the numbers we're talking about today are not today's numbers. They represent transmission that occurred a week or 2 weeks ago. We can't change numbers today, but we can change the numbers for 2 weeks from now, for example. So that's why it's so important for everyone to do their part. The government will continue to work on testing to accelerate information for people. To control the pandemic, everyone must do their part. We must stop the spread of the virus. We need to not catch it ourselves, get it ourselves, and spread it to our neighbors. So what does that mean? It means washing your hands, wearing a mask, keeping your distance from others, staying at home if you can, not going out to see friends, and downloading COVID Alert, the app. Even in regions that haven't opted in yet, it will start working right away. It's free. It's easy. It protects your privacy. And it is a tangible asset that will help us to control the spread of COVID-19.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Next question from La Presse canadienne. Good afternoon, Mr. Trudeau. As you know, there is a current conflict in Azerbaijan, and they fear a second genocide. The situation has been denounced by Emmanuel Macron. And are you aware of the fact that Canadian weaponry has been used in the attack? The Prime Minister speaking. We are very concerned with the situation in that region. We have called for a ceasefire dialogue. The situation has escalated. We are working with our international partners to try to restore calm. We acknowledge that the situation has gone on for some time, but there is no military solution. It must be resolved through dialogue and the desire to resolve it by the parties involved. As regards the export of weapons, I know that the Minister of Foreign Affairs has immediately launched an investigation to determine how Canadian equipment could have been used in the situation there. We will be following up on it, and we will have more comments to make on that in the future.
Extremely concerned about the situation in Nagorno-Karabakh. It's a conflict that has been bubbling along for a long time, but the recent escalations are extremely concerning, both for the countries involved and for the region. We need to see a de-escalation of hostilities. We need to see a restoration of dialogue and negotiation. We're calling on calm. We're working with our partners internationally to see this situation resolved. There is no question, there is not a military solution to this conflict. It can only be resolved through proper dialogue and engagement. In regards to the Canadian military equipment that may have been used in this situation. The Minister of Foreign Affairs has launched an investigation into what exactly happened. It is extremely important that the terms of Canada's expectations of non-violation of human rights is always respected, and we will have more to say as more becomes clear.
Une suivie, Catherine?
Oui, je reviens aussi rapidement sur la crise d'octobre.
The journalist. Yes, I'd like to go back to the October crisis. The Bloc Québécois this month has said that it will be attacking you on these comments. The Prime Minister, Catherine, I've already answered this question. My concern is what's happening in Quebec and across the country as regards COVID-19. We will continue to be there for Quebecers, for all Canadians who are facing this second wave.
Tanda.
Good morning. Prime Minister, I wonder if you could tell us exactly when and how you learned of President Trump's diagnosis and what your first thoughts were, and whether you see, if you have any expectation that there will be a meaningful escalation of that administration's management of the COVID pandemic.
When I woke up this morning, I was apprised by my team that the President and the First Lady had tested positive. Of course, my first thoughts are in support of them, and I hope for a speedy recovery. They had certainly reached out when Sophie got her diagnosis earlier in the spring. But let's not forget that yesterday, thousands of Canadians received a positive diagnosis of COVID-19. People are challenged with this every single day across our country, and our responsibility as a government is to do everything we can to support them and to arrest the spread of COVID-19, and that will continue to be our priority.
Expectations of the U.S. changing how they manage.
Ce matin, quand je me suis réveillé, j'ai été avisé.
The Prime Minister speaking. This morning when I woke up, I was apprised by my team that the President of the United States and the First Lady had tested positive for COVID-19, so I wish them a very speedy recovery, as they did several months ago when she was diagnosed with COVID-19. And we have to bear in mind that every day, in recent days, thousands of Canadians have received a positive diagnosis for COVID-19. We must do our utmost to help them to get through the pandemic here in Canada. And I encourage all countries in the world to do their part.
Prime Minister, in some parts of the country, people are facing very long lineups for testing, even longer waits to get the results back. People are missing work. Kids are missing school because of this. And yet some Canadians are able to go to the private sector and get tests at clinics, effectively bypassing the line, including your own MPs who can go over to Gatineau and have the House of Commons pay for their own test. Do you think that's fair? And do you think it's consistent with the principles of the Canada Health Act that some people can buy their way to the front of the testing line?
We've said from the very, very beginning that testing is going to be key to getting this pandemic under control. That's why from the spring, we worked with the provinces on increasing testing capacity, on delivering equipment and reagent and supports needed to scale up the testing. As a key part of the Safe Restart initiative, we transferred $19 billion to the provinces, including significant amounts so that they can scale up testing right across the country. In many parts of the country, testing is well under control, but in places where the virus is hitting harder these past weeks, we've seen challenges with testing amounts. We're going to continue to work with the provinces to ensure that they have the capacity to meet the needs to get this virus under control.
Hi, Prime Minister. Tom Perry from CBC. On Donald Trump, the president was quite dismissive of the threat of COVID. He didn't want to wear a mask. Do you think now that he's been diagnosed as having coronavirus, that might make the administration take this threat more seriously so that we might be able to get the virus under control and Canada might be able to reopen the border with the United States?
Obviously, we want to see the virus come under control right around the world, across Canada and around the world. And that's how we've been acting as part of international vaccine initiatives, part of doing our part to get this virus under control in Canada. And we've seen other countries do different things. Obviously, there is an election going on in the United States where stances or approaches on COVID-19 have been a polarized political issue. In Canada, we've been extremely lucky that it has not, that there has been a concerted effort across orders of government, across political parties to work together to be there for Canadians and to get this virus under control. We're certainly going to continue with that in Canada, and we recommend it as a path for people all around the world.
Prime Minister, in light of news about President Trump, what specific precautions do you take when you're working with your staff? And have these precautions have they changed at all in the last 2 weeks as cases have risen?
From the very beginning, my staff, my office, and as much as possible, everyone in government have been following public health advice. We have consulted directly with Dr. Hammond-Pihak on many instances, including around questions of meetings and potential travel and announcements. We will continue to follow public health advice every step of the way as it evolves and as it is adapted to the situations we're in right now.
Prime Minister Mike Lukather from Global National. The Alaska to Alberta rail line has just been given a presidential permit to go through Alaska. Much of the proposed project goes through Indigenous lands. In the past, your government has been heavily criticized for failing to consult Indigenous people on other projects. So I wanted to know, what have you learned from those past experiences, and what guarantee do those communities have that you will properly consult them on this one?
First, in regards to the project, no project has been submitted to Canada at this point. But I can say that we have significantly improved impact assessment for projects, including with Bill C-69, which ensures that consultation with Indigenous peoples and other communities are put at the very front of the project, that it is part of the very first steps taken by any proponent to talk with local communities, to talk with Indigenous peoples, to see where the challenges will be and to look at the level of acceptability of that. C-69, as opposed to the previous Harper assessment, which backloaded Indigenous consultation, is going to be much better at seeing off the bat whether there is a potential for a project before the proponent goes too far down the road and invests too much money in it, in something that is unlikely to pass, or find out early that perhaps there's a different approach that is better. That was our commitment to the industry, to natural resource projects, to proponents of large-scale projects across the country, that we would accelerate the timelines, that we would get more clarity, and we would ensure that they knew early on if there were low chances that that project could eventually go ahead. We're going to continue to make sure that consultation with Indigenous peoples is a part of every major project in this country.
Bonjour, Monsieur le Premier ministre, Christian Noël de Radio-Canada.
The journalist. Prime Minister, because the borders closed since the start of the pandemic, families are separated. They're missing important events like births, health issues, funerals. At the beginning, the government didn't seem to be open to allowing these people to come into Canada. But now you appear to have changed your mind. Why? The Prime Minister. We didn't change our mind. The priority of the Government of Canada must be and continues to be the safety and health of all Canadians to prevent the spread of the virus. Over the past months, we have learned better ways of protecting Canadians, of improving protection. Quarantine processes have an impact, and we've seen that the spread of the virus by foreign visitors is very low when it comes to current outbreaks. We'll continue to look at ways of improving these systems so that importing the virus does not become a problem we will enhance measures, but at the same time, hearing heartbreaking stories about families, well, we will be making an announcement on compassion. Minister Blair, Haidu, and Mendocino will be making an announcement soon, but we will always work to establish a balance between protecting people and understanding the human tragedy, the human difficulties that occur because the border is closed. But at each step along the way, we will look at what's working and we will make responsible decisions for all Canadians.
Beginning, our priority has been quite singular, making sure that Canadians are protected from COVID-19. And that has meant taking strong actions at the border and continually looking how we can improve our actions to prevent importation of COVID-19. Now, as we look at this second wave, we see that community transmission is by far the biggest challenge in this situation, and that importation of cases from outside the country is a tiny fraction of the situation, which means that what we're doing is working and we need to continue it. However, we can always look at ways to improve our measures while keeping Canadians safe and do a better job of understanding the heart-wrenching stories of families divided, of compassionate cases that should be given flexibility that wouldn't endanger Canadian safety. And that's why Ministers Haidu, Mendocino, and Blair will have an announcement a little later about how we're going to continue to strengthen measures that keep Canadians safe through border measures, while at the same time moving forward on allowing for more compassionate cases and other elements. But every step of the way, we will be driven by the priority of keeping Canadians safe from the importation of the virus, based on the best data, best evidence we can gather.
Thank you. The Prime Minister will now excuse himself, but the ministers and doctors will be available for more questions. We'll go to the phone for our next question. Operator.
Thank you. Merci. For questions directed to the medical staff, please press star 1. Pour des questions dirigées vers l'équipe médicale, s'il vous plaît, faites étoile 1. Notre première question est de Dylan Robertson, Winnipeg Free Press.
Hi there. A question for Minister LeBlanc. The Pallister government says that you're blocking Manitoba from procuring the Abbott ID Now rapid test that Health Canada approved this week. He said that Manitoba also had a shipment diverted by the U.S. government to Ottawa for N95 masks earlier this year. The Premier said that he raised these in a call last night. I'm just wondering how many times Ottawa has been blocking provinces from accessing supplies.
Well, obviously, our objective is not to block provinces from accessing supplies. It would, in fact, be to work collaboratively with provinces and territories to ensure that all Canadians and all orders of government have the necessary supplies to keep Canadians safe. I was on the call last evening with the Prime Minister when Premier Pallister raised this, and obviously anything that would improve the safety and security of Manitobans is something that we share Premier Pallister's concern around. So we're working directly with his government and the government of Manitoba, as we have from the beginning. And the Prime Minister reassured Premier Pallister that we would be there to support the needs of Manitobans and his government ensuring that they're safe. But that, of course, applies right across the country as well to every other province and territory.
If I understand correctly, you're saying that they will be able to get the Abbott test after all?
What I'm saying is that we will follow up on, it was the first time, certainly, that the Prime Minister and I had heard that specific example from Premier Pallister on the phone last evening. On the 19th First Ministers meeting that the Prime Minister has had since the beginning of the pandemic. So we'll follow with the appropriate health authorities the specifics of that particular case. But the Prime Minister reiterated to all premiers in the call last evening, obviously including Premier Pallister, that we want to work collaboratively with every jurisdiction. And that's been certainly Dr. Tam and the Public Health Agency of Canada's priority from the very beginning. And it's achieved successes across the country, but we need to continue to make efforts collectively to ensure that that success continues and is shared across the country.
Thank you, Minister. We'll now turn back to the room.
Prime Minister wouldn't answer this. I want to get your views on Canadians who are jumping the line to go get private testing. Do you think that helps overall? It's a relief valve, fewer people having to line up for public testing? Or do you think it kind of bypasses the spirit of the Canada Health Act and allows people to, as I say, jump to the front of the line?
Just say I'm not the minister. I've acquired a new title in your question. So yes, I'm not. Yes.
Dr. Tam?
I'm actually not really versed with the situations that you're talking about. I just know, in my experience, it was, for example, and Dr. New knows this, that when the NHL, for example, was coming into playing their games in a very tight bubble, we knew that they had to pay for that, and it should not impact on the public health system. So that was the last experience I had in this sort of discussion. So I'm not aware of what you're talking about or the size of the problem, but I think it depends on the situation. But certainly in a situation like the NHL, we believe that they should not impact the Canadian system and that the tests are being paid by the private sector.
Follow-up for Minister Joly on the funding for the regional development agencies. Can you tell me exactly what kind of criteria are going to be set for these programs? And is the idea here to provide relief for businesses that have already suffered, or is this going to allow businesses to stay shut in places that are being impacted by the second wave and therefore hopefully reduce transmission? Could you explain kind of the philosophy there?
Yes, well, the philosophy of it is to make sure that in certain cases where businesses want to have access to the wage subsidy and they don't fall under the criterias, or the CEBA account, the $40,000 loans, and they're not able to, they can come and see us and we'll be as a backstop to help them have access to measures. At the same time, since our regional development agencies are very, very close to the ground in many, many, many places across the country, we know that sometimes a business is very important for a given community and they need to have access to capital. So we've been providing that capital for them to keep the jobs. So that's why at the end of the day, we are now at a level of 95,000 jobs that have been protected. What we've seen also is in certain sectors that are most hard hit, such as the tourism sector, for example, businesses have difficulty to have access to financial tools through the financial system because risks are higher and banks are more difficult to a certain extent. And so what we've done is we've been there for them and we've been providing the microcredit that they need. So that's why, for example, in Northern Ontario, half of the funding we've came up with was for tourism operators and lodges and hotels, because this is a sector that is really hard hit. So these are just examples. And finally, the last thing I would say is we've been collaborating with chambers of commerce all across the country to provide technical help to many businesses. When an entrepreneur is facing an economic tsunami like we're going through right now, a lot of times they really need help because they need help to retool, find ways to develop their operations, keep their employees, and it can be extremely stressful. So we've been funding the advice they can have access to in order for them to get.
We have a few more minutes before the doctors have to leave for another commitment, so we'll go back to the phone for another question. Operator, over to you.
Thank you. Merci. Prochaine question, Émilie Bergeron, Agence QMI, à vous.
Oui, bonjour, ma question est pour...
The journalist. I have a question for Minister LeBlanc. Yesterday, you spoke with the first ministers from the provinces and territories alongside the Prime Minister. Was a date set for the meeting on the health transfers that has been promised. It's supposed to be taking place sometime this fall. The Minister. In his opening remarks, when the discussion began, at the start of last night's meeting, the Prime Minister confirmed to his counterparts in the provinces and territories that our teams are working together and have been for several weeks now. There have been meetings at the Deputy Minister level in order to set a date in the weeks to come. We hope within the next week or two to be able to agree on a date. The First Ministers have been talking about the importance of health care. Clearly, we share those concerns. Canadians need a healthcare system that meets the challenges, rises to the challenges we're currently facing. The dialogue is constructive, and it will be in the next few weeks that we will be announcing it based on everyone's schedule. We hope that within the next 10 days to be able to provide you with the date.
Oui, merci.
The journalist. A second question for Ms. Joly. A question was put earlier about apologies regarding the October crisis, deportation of Acadians. This is something that often comes up. Maybe Francophones don't deserve or get apologies as frequently as others. So what kind of a comment would you have to say to that? Minister Joly, Francophones are at the heart of our concerns. As a Francophone myself, I am very proud to be part of a country that respects our culture, our rights. Our concern for Francophones revolves around respect for our culture and speaking our language. We know and want to ensure that we can continue to do that in the centuries to come. In the throne speech, for the first time, I can proudly say that the French language is a minority language in North America, but that means we need to do more, and we acknowledge that in the throne speech. In the circumstances in the weeks to come, we'll be working on strengthening and reinforcing the Official Languages Act. We need to protect French outside of Quebec and English minorities within the province. The moderator. Thank you. That will be all.
Thank you. The conference is now ended. Please disconnect your lines at this time.